The COVID-19 vaccine is here, and you have questions. We have the leading experts here with answers. Sponsored by the Virginia Department of Health.
Getting vaccines into the arms of Virginians. From Hampton Roads to Southwest Virginia to our state capital, thousands have been lining up for protection against COVID-19. When is it your turn? And is everyone getting a fair shot? That's some of what we'll be talking about tonight during this live town hall. Vaccinate Virginia, your questions answered. I'm Juan Condi. Some of Virginia's most trusted experts are with us tonight to answer your questions. You can also use the hashtag Vaccinate Virginia to ask questions during our show or call the Department of Health hotline later. That number is appearing on your screen. Joining us tonight, Virginia's State Health Commissioner, Dr. Norm Oliver.
Hi.
Pleasure to have you here with us this evening.
I'm glad to be here.
Once again, yes. Also in studio with us, Dr. Danny Avula, Virginia's COVID-19 vaccine coordinator. Joining us virtually this evening, Dr. Cheryl Ivy Green, Vice Chair of the Virginia African American Advisory Board, and Dr. Cecilia Barbosa, Chair of the Health Committee for the Virginia Latino Advisory Board. And White House Senior Policy Advisor for COVID-19 Equity, Dr. Cameron Webb, should be joining us in just a little bit. We'll also hear a little bit later from VCU Massey Cancer Center Director, Dr. Robert Wynn, Roanoke and Allegheny Health District Director, Dr. Cynthia Morrow, and UVA Health Geriatrician, Dr. Lori Archibald Pannoni. Before we dive into the vaccine rollout, Dr. Oliver, let's start with some breaking news that came out today. We learned from the CDC that 2 masks are better than 1 to prevent the spread of COVID-19. So let's listen first to a clip from today's White House briefing.
The bottom line of that study is actually to improve the fit of the mask, and a second mask is one of several options.
All right, so that's Jen Psaki there at the White House. Dr. Oliver, can you explain more about that study and the options that the press secretary explained to us?
Well, one, it's sort of common sense in many ways, right? If you put on more layers, you can decrease the ability of the virus to get through and therefore protect yourself more from that way. And also, if you are the one who are carrying the virus, it's less likely to get out of 2 masks than from 1. This was common sense before, but what this study has done is actually shown that it's 95% more effective at preventing the transmission of the virus.
That's quite a bit. The CDC said it didn't recommend this as a general guideline because they're still having a difficult time getting folks to wear 1 mask. If you're into wearing masks, now you know that 2. And the suggestion is that you have a surgical and then a cloth on top? Is that the
the surgical mask underneath and then the cloth over that is the best way to do it. Or you can wear a mask with 2 layers. That also will work.
Okay, so just double.
Yes.
We also learned this afternoon that the FDA will consider emergency authorization for the Johnson & Johnson vaccine February 26th. Now, this vaccine is a single dose and only 65% effective compared to efficacy rates over 90% for the Moderna and Pfizer vaccines. How would Johnson & Johnson approval change the landscape for us here in Virginia?
It will add a great many doses that we can then get into the arms of residents throughout the state, and that's going to protect them. 65% protection is quite a lot of protection, and it's certainly a lot more protection than not having a vaccine at all. So I would encourage people to take advantage of the Johnson & Johnson vaccine should it become available. If the FDA approves it, like they did with Pfizer and Moderna, that's a Friday hearing that they'll have. We could have doses that very next week.
So production's already underway. They're waiting for the approval to distribute those.
Yes.
Wonderful. So there have been, unfortunately, over 537,000 cases of coronavirus in Virginia, with a death toll approaching 7,000. Our state's positivity rate tonight is 10.1%. So how is Virginia doing, and how do the new UK and South Africa variants affect what we're doing here? Those are mutations of the original virus and may have different effects on people and require different strategies for treatment.
Yes. Well, we're doing better than we had been doing, say, a month ago when we were seeing a really big surge. People do have to realize, as you just pointed out with those numbers, that those are still high numbers. Last April, when we were all concerned about the rise in cases, we're currently having 3 times as many cases every day as we had back in April. So the virus is out there. We need to protect ourselves from it. We need to wear those 2 masks, wash our hands, maintain our physical distance from one another to prevent the spread of the virus. The UK and South African virus mutations are much more transmissible. they spread more rapidly, and that's the real danger with them. The UK variant and the South African variant have both been identified in the Commonwealth of Virginia. Because they spread so rapidly, and because most of us have not had COVID-19, that means that it could take off, and models would suggest that sometime this spring we could even see another surge. So what that underscores is the importance of getting vaccinated. The more of us who are vaccinated, the fewer of us who are going to be vulnerable to any of these variants.
So it really is wonderful that we're having supplies of vaccine increase and new vaccines come into the system at the same time that these variants are appearing and increasing the risk for the general population.
Exactly.
All right, Dr. Oliver, thank you very much.
Well, thank you for having me.
We'll come back to you in just a couple of minutes here on the show. Virginia first started COVID-19 vaccines back in December, and that's nearly 2 months ago. Frontline healthcare workers were the first to receive those vaccines. Tonight, Virginia has administered more than 1 million doses. That means about 11% of Virginians have had at least one dose. Just over 225,000 people, I should say, are fully vaccinated. So joining us now is Virginia's COVID-19 vaccine coordinator, Dr. Danny Avula. Nice to see you.
Great to see you, Juan.
Been a rough year.
Sure has.
It really has, and you guys are still busy. A lot of burning questions from our viewers tonight for you, and we'll begin with video questions that have been sent in from across Virginia. We'll begin with the question that is by far the most popular one that we've received.
Hi, my name is Liam Chavez. I'm 23 years old from Norfolk, Virginia. When can I be vaccinated?
Where's all these doses that are supposed to be available that are supposed to be available for everyone?
Would there be plenty to go around for the population?
When will COVID vaccines be plentiful enough for healthy people under 55 to get the vaccine?
All right, that wasn't one question really, but a couple all put together. To sum it up, we want to explain for the folks at home who's being prioritized right now and when can more people expect their turn.
Yeah, I think it actually did a great job of summarizing the question I hear 100 times a day from folks all over the Commonwealth, which is when can I get vaccinated? And here's the deal. The entire state is in phase 1B, and 1B includes many of the essential workers that are required for our society to move forward, right? Folks who are policemen and firemen, people who work in corrections or in homeless shelters, our teachers and childcare workers, and there are many other categories that are in 1B. If you go to vaccinate.virginia.gov, you can find a complete list right on that site to let you know what categories are being prioritized right now. In addition to that, individuals who are 65 and over are absolutely our priority right now. We know that age is one of the biggest risk factors for hospitalization and death due to COVID. And so we're absolutely prioritizing individuals who are 65 and over and those who have severe underlying conditions. But here's the deal. 1A and 1B constitute about 50% of Virginia. That's a lot of people who are currently eligible to get vaccinated, and we just are not getting enough vaccine to move through that category very quickly. We're getting about 130,000 new doses every week for the entire state. And at that rate, we've seen small increases in vaccine recently, but what that means is if this pace continues, it's going to be 2 to 3 months before we get through all of 1B.
Yeah, almost 4.5 million people in those first two groups alone. Our population is about 9 here in Virginia. Let's go to another video question now. This one's from Richmond about registration.
There doesn't appear to be one universal list so that an individual can go register on a Virginia list, identify their zip code location.
All right, so folks frustrated with the registration process, which is really being administered, as we understand, through local health departments. So what can folks do if they're having trouble getting through? And how does the new central call center for our state factor into this?
Yeah, so, you know, when we were in phase 1A, it made sense for the local health departments to take the lead on registration. They were setting up the events, they were populating those events and making appointments. But when we moved into 1B, that number got a lot bigger very quickly. And so what has happened is that people all over the state have experienced the frustration of not being able to get through to an appointment, not being able to get in touch with with their health department. And so we've realized very quickly, we've got to build capacity centrally to do that. At some point later next week, we will have a centralized call center, one number that everybody in Virginia can call, along with a centralized pre-registration process. So stay tuned for exciting news on that towards the end of next week. There will be a solution for folks who have been trying to figure out how they can get on a list. In the meantime, please go to your local health department website, either enter through the web form there or call your local health department to get on that pre-registration list.
Is there a way to tell if someone's registration has been effective, if it worked, or where they are on the waiting list?
Yeah, we've heard that concern raised many times, that people will submit their name on a list and weeks will go by, they don't know if they're still on the list or not. That is one of the things that we will absolutely address when the new centralized pre-registration process rolls out. People will get a weekly reminder saying, hey, you're still in the queue, and they will also have the ability to go to that site and determine if they're still on the list. It doesn't exist now, but when the centralized pre-registration process rolls out, you'll be able to have that option.
Okay, so once again, how long should folks wait to be notified if to know that they're in the queue?
They'll get weekly updates.
Once
we move to the centralized pre-registration list, which should be end of next week or so, they'll get weekly updates.
All right, so once you are notified, what happens, and this may be because of any number of factors, if you're unavailable for the appointment time that you've been given?
Well, in most cases, what's happening is that you get a link or you talk to somebody on the phone who will actually schedule your appointment. So you have some choices based on how many people are being served at an individual event. You'll have some choices for different times for that event. If you can't make any of those times on that particular day, you will need to get back with your health department, let them know where you were in line, and see if they can schedule you for the next event.
All right, we're facing a pretty big, nasty winter weather system tomorrow into Friday. What happens for folks who've been scheduled for vaccinations during this period when weather may be so inclement they can't make it or the clinics can't be set up?
Yeah, well, this has happened a couple times throughout the state already where the entire event is canceled. That event will be rescheduled and all of those appointments will remain. And so you'll get that communication from your health department about the rescheduling of that event. You'll still have an appointment and so you'll just have to wait for that communication from your health department, or you can reach out to them directly.
It sounds like a lot of what we're doing is counseling patients. As always, it makes things a lot easier. So once you get a first shot, are you automatically scheduled for a second, or do you have to wait for an appointment to get the second as well? And how does that notification process work?
So that has not happened to date. You know, I think many providers weren't certain about when that second dose was coming. They were hesitant to make appointments that they might have to cancel if they weren't sure they were going to get a second dose. But what we have seen consistently from the federal government now for 4 straight weeks is that they have delivered on every second dose request that Virginia has had lined up. And so I think everybody is reassured. All the providers are being instructed to make second dose appointments at the time that you have your first dose appointments. Many of you had heard that pharmacies will be more involved in providing vaccinations. So this week, CVS is bringing new doses to Virginia. They are scheduling first doses and second doses at the same time. And so that will be, moving forward, those second dose appointments will be scheduled at the same time as your first.
We've heard from a bunch of folks who live in smaller cities or rural areas who believe it's unfair that the vaccine distribution appears to be based in more urban areas where there's more population. Will the CVS involvement in our vaccine program help to alleviate those problems and spread vaccine more widely across the Commonwealth?
To some degree. I mean, the CVS is bringing vaccine to 36 different locations, which is really exciting. They've 26,000 new doses a week. So this is an opportunity to bring more vaccine into Virginia, about a 20% increase in our weekly allocation. Now, there are certain parts of the state, particularly in Southwest Virginia, that just don't have the same footprint with CVS. And so what will be coming in about 3 to 4 weeks, we're told by the federal government, is that other pharmacy chains will be added to that list. So places like Walmart and Walgreens, some of the grocery store pharmacy chains, Giant and Safeway. So there will be more options in just a few weeks for some of those more rural parts of the state.
Wonderful, but they are being considered and included in what's going on.
That's absolutely right.
Dr. Avula, thank you very much. We'll come back to you in just a couple of more minutes with a few more questions. But first, let's listen to this.
How do the people who are not computer savvy going to be able to register without the help of a kind neighbor, a friend, a family member, something like that?
A great question. We'll answer it and talk about the challenges with this week's CVS vaccine rollout when Vaccinate Virginia returns. Welcome back to Vaccinate Virginia. Your questions answered. We want to talk now about health equity and the historic distrust of medicine in Black and brown and minority communities here in the Commonwealth. To begin that conversation, we'll bring in Dr. Cheryl Ivy Green, Vice Chair of the Virginia African American Advisory Board. Dr. Ivy Green, thank you for being with us tonight.
Thank you, Juan, for having me.
Can you tell us specific concerns that you've heard about the COVID vaccine among our African American and minority communities?
Well, one of the major concerns is that the African American community is receiving the vaccine at a far lower rate than others in our community. So there is some level of mistrust about access to the vaccine. We are dying at a rate 3 times that of others in the community. And so there are reasons that we need the vaccine. Folks are concerned whether it's safe. Do I take the Moderna or the Pfizer? And what about when Johnson & Johnson is approved? Do I take that? How effective is it? And then the other concern is, how is it being communicated to underserved communities and seniors and those without access, as I heard just a little bit earlier, to technology to be able to sign up online?
Interesting. So what is the state doing? What is Virginia doing to help allay those concerns or to comfort those folks or give them hope in what's going on as far as the vaccine?
There is a great effort in terms of the Department of Health to reach the African American community. I think there could be more, but I think they're working towards that. But one of the major things I think is engaging fully with the faith community. The African American community typically trusts the church, and that it has been the center of our community. And so I think it's great that they're engaging with the faith community, but I also think it has been great recently in the Richmond area where we have selected certain community sites to provide the vaccine. Now, having said that, in other venues, there has been some concern about the fact that they don't see people that look like them in that line. So placing these opportunities, or for lack of a better word, pop-up vaccine centers in the community really works. And so I think that the department is doing a great job of trying to educate the community, especially the faith community and other nonprofits, but I think that there's so much more we can do.
So outreach and education continue in this effort. What experience have you heard African Americans describe, those who've received the vaccine?
Those who have received the vaccine, one of the things, as I've just mentioned, is the people in line don't look like me. And so I'm concerned that it's not getting to my community. the other experiences they've had have been pretty good. They haven't had major side effects, just a little soreness in the arm, and then some have reported being tired after having the vaccine. And there is concern about the side effects, and so we have to be careful how we encourage people that those are so few. And so don't just go by what you see and hear in the media, but get educated, participate in opportunities like this to get more information about the vaccine.
All right, let's go to a video question now. Listen in here. This is from Hayes in Roanoke.
What is your opinion on those who are fully opposed to the vaccine, who don't trust the vaccine at all?
All right, across racial boundaries and barriers, Doctor, what do you say to Virginians who are hesitant about all this?
I would say take the vaccine. I think that the benefits far outweigh anything that persons in our community might be concerned about. There are very few people in the Black community who have not experienced losing multiple members of their family. I mean, entire families, friends, those who are just struggling with the vaccine. So rather than us stress over so many deaths and continue to watch that happen, take the vaccine, because when you take it, you not only protect yourself, but you begin to help us to communicate to others that it's okay to have the vaccine. Do your own research, educate yourself, but take the vaccine.
The proof is in the protection. All right, Dr. Ivy Green, thank you very much for being with us tonight.
Thank you.
Our pleasure to have you. We'll turn now to Katie Dupree, who's with a member of the Richmond community who's doing something unique to help encourage public trust.
We're joined now by Dr. Robert Wynn, Director of the Massey Cancer Center at Virginia Commonwealth University. Dr. Wynn, thank you so much for your time. First, let's talk about something that you have been doing called Facts and Faith Fridays. What is that, and how is that helping with trust in the COVID vaccine?
Yeah, well, Facts, Faith, and Friday really came out of a partnership between Rudine Mercer-Haynes and Pastor Todd Gray from the Fifth Street Baptist Church. And it was in response, I think, to the untimely death of Bishop Gerald Glenn, and really to just the fact as we were into the midst of the COVID crisis, there was a lot of misinformation and disinformation. So the Facts, Faith, and Friday group came about to really, one, not only to build trust, but to give trusted information on a weekly basis. So every Friday between 3 and 4, we have internal experts from VCU. We have external experts like Dr. Fauci and Sharpless and other people from the NIH and other places to come in to really give these faith-based leaders the most accurate and the most trustable information possible. And I believe that because we've done it over a weekly basis, ever since March of 2020, we've built up really, I think, a huge knowledge base that they're able to take not only to their congregations, but also to the community. And really, again, not only are we building trust with them, I think they're building trust with others and making sure that they have trusted source of data and information.
Yeah, absolutely. How can people get involved if they want to watch that?
The wonderful part about it, from its inception, it has always been open. And so we've made it easy in the context of when we have some Zoom lines, we'll give Zoom connections, but understanding that there is something called the digital divide, and it is real. In some of our rural areas and even some of our urban underserved areas, we have traditionally made most of these meetings by phone. And so most of the meetings, or the majority of the meetings, have been by phone call because while people may not actually have access to the most high-speed broadband, most people have access to a telephone, whether it's a landline or whether it's a cell phone. So we will continue to do it by really trying to reach the maximum number of people, but it's as easy as calling the Massey Cancer Center, getting that information from my administrative Lindsay, and then being able to join.
Yeah, accessibility is important. Thank you for that. What is your advice to people who are hesitant to get the vaccine?
Yeah, I understand the hesitancy. To be quite honest with you, with the amount of misinformation, with the disinformation that's been around, with the lack of centralization and organization, it has to be scary. And when people hear about the fact that, well, is this vaccine, for example, warp speed, it must have only been, created in a week or two or a month or two, and now they're giving it to us. They just don't understand the background. For example, warp speed may have been a misnomer, but this is if the Beatles were an overnight success or Beyonce was an overnight success. None of that's true. This drug and the vaccine that we're actually now benefiting from has been around since 2008 and has been worked on since that time. So this is not an overnight success. This has been something that's been in progress for a very long time. So I think that in that case, we really are just trying to make certain that people understand that I appreciate their hesitancy, but with over 400,000 people now dead and looking towards 600,000 people dead, the reality is you have a real check. Do you want to have COVID and die, or do you want to take your chances on the vaccine? I'd actually vote for taking our chances on the vaccine. And as we're now looking beyond the clinical trials and looking at the effectiveness of this drug out in the community, it looks to be incredibly safe.
All right. And a new study led by Massey Cancer Center shows that parents of children with cancer are more likely to believe COVID misinformation. Why do you think that is?
Well, I think for a couple different reasons. And one of those is because they're frightened. I mean, you can imagine that, they already have a kid that's actually, immunocompromised. Their immune system is weakened because, they have cancer and now they have therapies, and they're wondering, well, what will happen to my child? And particularly if I take the vaccine. So again, there's some misinformation and disinformation that's out there. We know that cancer patients are certainly at increased risk. And in fact, we also know that if you are a cancer patient under active treatment, we would prefer that you speak with your physician first before you take a vaccine. Why? It's simple. Because if your immune system is taxed, the vaccine depends on an immune system. So a weak immune system with the vaccine may not be nearly as good as a stronger immune system, which is one of the reasons why it really comes down to an individual basis when we're talking about our cancer patients. Now, the vast majority of the patients who are kids and their parents aren't actually active cancer patients at the time, have nothing really to fear. And so again, I think we're just needing to do a better job as a health system in getting that information out there.
Is there anything else that you'd like people to know, maybe with a new strain being found here in Virginia, just anything in general people should know at home? Yeah,
probably two things. I think that the variations in the strains are probably, to be quite honest with you, not unexpected. But the wonderful part about this is that the vaccines, particularly the vaccines that are out there right now, the Pfizer, the Moderna, and it looks like the Johnson & Johnson, will be able to tackle all of the variants of those of the viruses as they come along. And I think that that's a good thing.
It is a good thing. Thank you so much for your time. Dr. Robert Wynn, Director of VCU Massey Cancer Center. Again, thank you for joining us. Juan, back to you.
All righty, thank you, Katie. You heard it right there. The vaccine is both the Beatles and Beyonce, all wrapped into one, under development and worked on for quite a long time. Let's turn now to issues impacting our Latino communities in Virginia. We're joined now by Dr. Cecilia Barbosa with the Virginia Latino Advisory Board. Dr. Barbosa, thank you for being with us tonight.
Good evening. Happy to be here.
Oh, thank you. What specific concerns do Latino communities have about the vaccine?
Well, I echo a lot of what Dr. Green and Dr. Wynn said. Some of the same things that you've heard for the African American community apply also to the Latino community. I think there's a mix. We've heard that 4 in 10 Latinos are actually ready to get the vaccine. 4 in 10 are in that wait and see mode. And then 1 in 10 are saying, I don't want it. And the others are saying, I'll get it if I have to. So for the ones who are ready, they just need more information about how and when, and Dr. Avula talked a little bit about that. For those who are on the fence, I think they want to hear about the safety and the efficacy of the vaccine, and also in particular for the Latino community and other immigrant populations, am I eligible to get the vaccine? If I'm not a US citizen, if I'm not a resident, am I still eligible? And thankfully they are. Asking about the cost of the vaccine, and thankfully also it's free, or do I need health insurance? Those kinds of sort of systems issues that they worry about, what kind of information we'll have to share. and also just being able to know what are the reliable information sources that are out there.
What are some of the challenges that we have related to language, specifically for health districts who have websites that are only in English?
Well, in actual fact, all the websites of the Virginia Department of Health, the main one and for the local, they have the option of accessing it in Spanish. And in addition, some of the districts have additional materials that have been translated. So that's not so much a barrier. I think the greater barrier, perhaps also a barrier, is accessing the internet and having computers. So I'm really happy to learn about the call center and that there will be Spanish speakers on that call center ready to answer questions in Spanish.
What can communities of color do while they wait to be vaccinated? I mean, we talked a little bit about social sort of constructs that can help, churches, that kind of thing. How would we answer that for folks?
Well, I think you need to learn as much as you can about the vaccine from reliable sources. Stay vigilant and be patient, but stay vigilant about the public health measures, because we need to all take those public health measures seriously about wearing the mask and social distancing and washing hands, and until we get to herd immunity. So, and sign up for the vaccine when your time comes. The other thing I would encourage is that people become ambassadors in their communities and help to pass on the word that this is a very good thing to do. That's the best thing we have, best tool that we have to get us out of this pandemic. And help each other, help and support each other, because this is a tough time that we're all going through.
Supportive social structures and infrastructure that gives out good information. Good advice there. Dr. Cecilia Barbosa, thank you for being with us tonight.
Thank you.
We turn now, once again, to Virginia's vaccine coordinator, Dr. Dani Avula, and we'll talk a little bit more specifically about the places where folks can get their vaccines. Let's listen into Ethan from Richmond, who sent in a video question.
I guess why aren't more local pharmacies giving it out so far? And I don't know, just trying to hit every different area and not just the highly populated areas.
This is sort of a variation on a question we received not long ago. So we know that CVS is going to begin administering vaccines at 36 locations across the Commonwealth. How is that rollout coming along? They delayed twice or three times their start dates, or their start dates for registration, I should say.
Yeah, well, this is the first week that vaccine will be available through CVS. Friday's the first day that they're going to be actually giving shots. The site went live earlier this week. Appointments went very quickly, and that will happen on a rolling basis. So every few days, there will be new opportunities to get vaccinated on the CVS website, and 26,000 new doses a week is a pretty exciting thing for Virginia.
What are the criteria and steps that someone would have to take to get a vaccine at CVS?
So the CVS has agreed to limit their vaccination at this stage to only individuals who are 65 and over.
Okay.
We know that there are many, many people around the state who are 65 and over, who are at higher risk, who need access to vaccine. And so they've agreed to integrate into our state strategy that way, make sure that they can prioritize the elderly. All people who register currently will have to go through the CVS website and sign up for an upcoming appointment.
We've heard some folks with underlying health conditions talk about registration and the difficulties they're having. Why weren't those people higher on priority lists?
Well, we followed the data to figure out who's at higher risk than others, and we know that age is really the biggest driver in many cases for higher risk of hospitalization and higher risk of death. And so that's why the 65 and over population was put in a separate category than those with underlying conditions. Now, we are still prioritizing underlying conditions, but that's a large group of people. And as I said before, working through stage 1B is going to take a couple of months. And so I would ask that those individuals with underlying conditions continue to do the things that we know limit transition, and eventually there will be an opportunity to get vaccinated.
Again, we're trying to do the best for as many people as we can at one time.
Yeah.
All right. We've heard from several folks claiming that they can be moved up or off a vaccine list or get in earlier if they know someone who has access. Are there truths to those statements? And what would you tell folks who are spreading that information?
Yeah, well, you know, for the processes that have been created by the state and by local health departments, we really are shuttling everybody to our pre-registration list. And so, you know, I've had a lot of people email me because I know a lot of folks around town, but they all go to that pre-registration list. And the lists are curated for different segments of the community. So for example, a health department might be doing an event for those who are 65 and over. They're going to take the individuals who are 65 and over off their list. And so, you know, there may be a sense that maybe people are getting advanced, but it really is for good reason. It's for, you know, the specific types of events that health departments are designing those vaccination opportunities around.
But it's not a case of favoritism or people moving up for reasons other than valid, scientifically supported medical reasons that you guys have thought about so far. Yeah. All right, one last question now. We hear that CVS is getting these doses, other pharmacies may follow. At what point will vaccine doses be available from doctors' offices, places where people go regularly and are familiar with staff and procedure?
Yeah, so there are a number of practices around the state that do currently have vaccine. Perhaps they're part of a larger health system and received initial shipments early on in the vaccine rollout. Right now, there are 1,500 providers around the state who are approved vaccinator sites. Now, as we get more vaccine, we're going to need every channel possible. We're going to want to put vaccine in as many outlets, pharmacies, providers, health systems, and health departments to get as much vaccine out as possible. We just don't have the supply to do that yet. I would expect we're probably 2 to 3 months away from it coming to many of the practices around the state.
So really, again, the bottleneck is just supply of vaccine and getting it to folks here in Virginia. Dr. Avula, thank you once again. We'll continue our conversation with you in a couple of moments. Let's talk now about the impact of COVID on older Virginians. John Rogers is here with that.
We're joined now by Dr. Lori Archibald Pannoni. She's a geriatrician at UVA Medical Center in Charlottesville. Doctor, thank you so much for joining us. So first, can you tell us what geriatrics is and how it ties into the COVID pandemic?
Sure. So geriatric medicine is a subspecialty of medicine that focuses on the care of older adults that are over 65 years of age. And so we are primary care providers as well as specialty consultants for the older population. And why that has become so important in COVID is that we've seen that COVID infection really has tremendous impact in this population, and our patients are at high risk of poor outcomes from infection. So keeping them safe has been paramount.
And a perfect follow-up. So what kind of impact have we seen on COVID on the older community?
Yeah. So we've seen that COVID infection itself can be more severe in the older population, have more risk of hospitalization, and the mortality rate is increased as well. But even separate from COVID infection, the impact of the COVID era changes on our population, our geriatric population, has also been great with the social distancing that is necessary and decreased community engagement. We've seen increase in social isolation as well, which we've been working to working against.
Clearly, many of our friends in the older community have been concerned. So there have been several challenges for getting the vaccine to older and elderly people. So what if they don't have transportation? What are your suggestions?
Yeah, so what we really need to do is come together as a community to help others in our community to access the vaccine, whether that be driving, accessing the computer, to sign up. There are phone numbers available as well, but asking for help from family or friends to safely, but to be able to access the community resources to be able to get vaccinated when it's our turn.
And many in the community in this elderly population are not very tech savvy. So how about technology? That could be a barrier. So what can be done to help out those who might not exactly be tech savvy?
Yeah. So again, reaching out to friends and family to help to sign up online if that's a possibility. If not, there are phone numbers available as well to call into your local health departments to get more information and to sign up through the phone as also. And you can also reach out to your doctors to ask them for assistance or guidance in the exact contact information for the health department.
So many people, doctor, are waiting for these vaccines. What should people do if they're older and they're high risk, but they don't necessarily meet the current age requirement for the vaccine?
Well, the vaccine the changes are coming quickly with the vaccine. Hopefully in the next weeks to months, we'll have increasing supply and be able to have more and more people getting the vaccine. But the key right now is to really get signed up, to reach out to your health department, to get into the line for when your appointment time would come up, and to make sure that you're registered in the system.
You know, right now, so many people are confused over signing up with CVS or the Department of Health. Are you hoping that things are going to get easier soon?
So hopefully, as we have more experience, and there are a lot of, people working really hard to make this a smoother process and transition, but as we have more experience, we'll be able to streamline some of those processes as well and make it easier for people to get vaccinated.
So, Doctor, do you have any other advice for older people during this pandemic?
Yeah, sign up, get vaccinated when it's your turn, but also don't forget your other chronic medical conditions. If you've been isolating or staying home to be safe from the virus, that's great, but you also need to make sure to keep in contact with your regular doctors to make sure that you're keeping up with your regular medical conditions. And then even after you're vaccinated, even after you've had time after the second dose, to still maintain precautions in terms of face coverings and social distancing until more in the community are vaccinated. So we'll still need precautions even after we're vaccinated.
Good advice for all of us. Well, Dr. Lori Archibald-Pannoni from UVA, thank you so much for all you do, and thank you for joining us today.
Thank you very much for having me.
Juan, back to you.
All righty, thank you, John, and thank you, Doctor. Our Vaccinate Virginia Town Hall returns in just a moment with more on the Biden administration's plans for vaccination and how that affects us here in Virginia. Welcome back. We continue tonight's Vaccinate Virginia conversation with a look at White House policy for COVID-19 response and how it affects us here in the Commonwealth. Joining us now, Dr. Cameron Webb, Senior Policy Advisor for COVID-19 Equity for the administration of President Joe Biden. Dr. Webb, you're a Virginian yourself. You work at UVA Medical Center. How do plans up in D.C. affect us here in the Commonwealth?
Well, first off, thanks so much for having me this evening. It's such an important conversation, and I know I've learned a lot from the folks who've come before me. The plans in Washington, D.C. are really complementary to the plans here in the Commonwealth. And for me, I'm a frontline provider. I work in the coronavirus unit at the University of Virginia. And so, thinking about how important it is to get, in particular, vaccine to our communities, that's something that's top of mind. And yes, some of that policy is playing out at the federal level, but it's being executed at the state and local level. So really the idea is they work really closely together. And in my role in the White House, advising the COVID response team in the White House, particularly on equity issues, a lot of the focus is on making sure that we're getting to some of those highest risk, hardest hit communities that we've talked about some this evening. And so I think absolutely some of the policies that we're working on are going to impact the Commonwealth. Things like making sure that we've got mobile vaccination units and our retail pharmacy program to get vaccine into more communities. Just yesterday, we announced our federally qualified health centers program. So a lot of different initiatives to increase access to vaccine. But we know access is only part of the equation. We have to find ways to increase demand as well. If you're thinking about the mechanisms for vaccine hesitancy. So we're working on all of that. I think this is it's a whole of government approach, and that includes really thoughtful partnerships with states and localities.
So you've mentioned some of the ways that the federal government is working with our state health department to access and to get into the lives of our most vulnerable communities. How does the new community health center vaccination program fit into all this?
Yeah, it's a really important program. And if you think about our community health centers, particularly our federally qualified health centers, that's a big program. And it's a program that serves a lot of Americans. And so I think the idea is if we're leveraging the spaces, using the spaces that are already serving some of our highest risk, hardest hit communities, those are the spaces precisely where we want to get vaccine. We know that we have to create mechanisms to drive equity. You can't just hope that it's going to happen. And so by leaning into the FQHC network, these are places that know how to reach patients, that are trusted messengers with trusted messages. And by making sure that they're getting supplied directly, I think that we're getting vaccine to some of those hardest to reach places. And keep in mind, some of these FQHCs, when I say hardest to reach populations, I'm not just talking about by race or ethnicity. I'm talking about, our homeless populations, folks who are undomiciled. We're talking about our migrant farm workers, right? We're talking about populations that are truly difficult to reach, but have relationships with these federally qualified health centers. And so, that program is actually going to start rolling out next week. But the idea is going to be to really ramp up to getting more and more vaccine there. The federal government through Health and Human Services is helping identify those initial locations, and then we're going to increase those. And so we don't know exactly which sites are going to be getting a vaccine. At least I don't from the White House, but I know our team at HRSA and at Health and Human Services and also with the CDC are identifying some of the highest yield places to start with that program.
I know that a bill hasn't been finalized yet, but can you tell us about progress with President Biden's COVID relief plan proposal and how that would change the landscape here in the Commonwealth?
Yeah, the American Rescue Plan, I think what I would say is that's a different branch of government. That's the legislative branch. And so at this point, from our standpoint, we're really hoping that Congress acts swiftly and that they're able to, the president put together a really thoughtful proposal that would enable us to get through this pandemic the right way. And when I say the right way, it's not just about getting shots in arms. I think a lot of emphasis is placed on 100 million shots in 100 days. And I think at this point, most of us recognize, we're on pace for that goal. Most of us recognize we can find 50 million Americans to vaccinate. That's not the tall task. The tall task is to do so equitably. The tall task is to make sure the same communities that are disproportionately dying from COVID, that are disproportionately hospitalized from COVID, and that are bearing the brunt of the cases, those communities are getting access to the vaccine. So, I think it's really important to note, some people have described these as competing ideas and say you either have speed or you have equity. And I absolutely reject the premise of that. I know the president does as well. We can have a fast, efficient process that's also equitable. And I think that the president's really laid that out in the American Rescue Plan. He's asking for the resources that we need in order to do that well. And so, at this point, it's in the hands of the Congress. And I think that there are a lot of legislators here in the Commonwealth of Virginia who are advocating for key parts of that legislation, and some folks who are in leadership. And so I think it's important to keep in communication with them and make sure they know how important this is to the American people.
Dr. Webb, are we building infrastructure at the federal level that will help us combat another pandemic when it occurs again here in the U.S.?
Yeah, it's great that you say when it occurs again. We have a really short memory as a nation in the history of kind of our public health threats. And if you look back just over the last 30 years, you'll see the number of times that we faced a public health threat, we've ramped up funding, and then we subsequently cut back on funding. We do ourselves a disservice every time we remove our investment in our public health infrastructure. It leaves us in positions like what we've been in since the start of 2020, when we came into this moment of pandemic and we just didn't have the infrastructure necessary. So I think that that's been an explicit goal of this Biden-Harris administration, is to rebuild our public health workforce, but to do so sustainably. And also, I think, and speaking from my perspective as, a policy advisor for equity in this process, we're talking about how to equitably be in a position to tackle any future pandemics, understanding that, there's an old adage that, when America gets a cold, the communities of color get the flu. That idea that, communities of color, minoritized communities tend to get it worse, it's because of the social determinants of health, those factors in communities that drive illness and that drive, distance from access to care. And so those are things that we have to think about. We have to take this moment, lean into it and say, how can we be better prepared to protect all of us from future pandemics? I think this is going to be a tough lesson for America to learn. We haven't learned it to this point, but I think that this administration is really focused on doing just that.
Dr. Cameron Webb, Senior Policy Advisor for COVID-19 in the Biden administration, thank you for being with us tonight and sharing.
Thank you.
We want to take a look now at how some individual cities and counties are handling their vaccine rollout. For that, we bring in Dr. Cynthia Morrow, Director of the Roanoke-Allegheny Health District. Dr. Morrow, thank you for joining us this evening. First, let's let everyone know you're in charge of the area that includes Roanoke City and County, Salem, Botetourt, Covington, and Craig. How is the vaccine rollout going in your area so far?
You know, truthfully, it's a bit of a roller coaster at the local level. You know, it's been so exciting to be able to get vaccine into arms. At the very first large clinic that we had, we partnered with one of our health systems, Carillion Clinic, and we vaccinated over 2,000 K through 12 teachers and staff. And after that, despite it being a busy, kind of crazy day, we were almost euphoric that we were able to get vaccine into arms. And it was such an exciting experience. We know that every vaccine we administer, we're doing something to protect our entire community. On the other hand, every day we hear stories about people who are just desperate to get vaccine, whether it's an 87-year-old woman who's alone in her apartment and has spent Thanksgiving and New Year's by herself, or whether it's a 74-year-old man who's just terrified of dying because he has underlying lung disease and heart disease. And knowing that we haven't been able to get vaccine to all of those individuals as quickly as we would like, it's heartbreaking. It's heartbreaking at the local level to feel like we're not able to serve our community the way that they deserve to be served. So it's a roller coaster. I think that the whole experience has been a lesson in humility for us. You know, we recognize that the community has this overwhelming need. We hear their concerns, we hear their frustration, and we witness firsthand the extent to which health inequity is impacting our neighborhoods. On the other hand, we know that we're doing good. And so it's, as I said, it's a roller coaster. I'm glad to be on the ride, but we all want to be on the other side of this.
Explain for us then, maybe more specifically, what the impact of COVID has been in your district, and then also the specific challenges that you've had because of your location geographically, maybe.
Sure. Well, you know, the impact that COVID has had on our community is no different than the impact it has had on other communities, in the sense that we've lost so many of our community members. Here in the Roanoke-Allegheny Health Districts, we've lost over 300 people. And we've had hundreds more hospitalized. We know that people who aren't directly impacted by the virus are indirectly impacted by it, whether it's that they've lost their jobs, whether it's that they've learned how to homeschool their children. It's been a devastating year for so many people. On the other hand, again, I think it's such a conundrum, because there is, even in this devastation, there is good. We have been able to build these partnerships with our healthcare delivery system, with media, with our schools, with our local governments, with our emergency managers, with our businesses. And I think that one of the things I hope that people get out of this is, despite all of the challenges, we're building partnerships that are going to help us help our communities long after the pandemic is done. And that includes addressing challenges. I think the biggest challenges for us, of course, has been that the supply is just wholly inadequate for the demand. And the other great challenge that we've had is in communication. We know that people are desperate for information, and it's hard to get hold of us sometimes because we haven't had the capacity to reach out to them in the way they deserve to be reached out to.
It sounds like your district is going to be much more prepared if we have to do something like this in the future. You mentioned that inequities exist in your system. Are the things that are happening now going to address those inequities as we move forward?
I hope so. You know, we know how pervasive inequity is, and certainly those of us in public health have been trying to address inequity for a long time. And maybe one of the silver linings behind this is that on the other side of this pandemic, we'll have better structures in place to help us serve every member of our community. Health inequity is a huge challenge, and I'm thankful to be part of an administration that has put health equity at the forefront of everything that we do.
What message do you have for folks in your district who may be frustrated with the process so far, despite the fact that you guys are obviously working so hard and so diligently to get vaccine to everyone who needs it?
Yeah, I think that our biggest message is we know how hard it is. We know that this has been a challenge. Stay with us, stay the course. We will get vaccine into arms. Working with partners, we're going to get vaccine into the arms of everybody who wants it. I also would like to appeal to people to look out for those neighbors who may not have access to technology. The same way that you reached out to your neighbors to help them get groceries, help your neighbors reach out and get them registered so that we can ensure that everybody has access to the vaccine.
All right, Dr. Cynthia Morrow, is there anything that you want to tell us that I've not asked you so far?
I think that the most important thing is that we are starting to see rates go down. We have the best tool possible. That's a safe, effective vaccine. We will get through this, but we're going to need to get through it together. And so just always keep in mind that partnerships are the way for us to stay healthy as we move forward beyond this pandemic.
It's wonderful to hear that. Dr. Cynthia Morrow is the Roanoke and Allegheny Health District Director. Thank you once again for joining us this evening.
Thank you so much.
More wonderful information there. Joining us once again, Health Commissioner Dr. Norm Oliver. Governor Northam's placed a great priority on getting kids back into school, into live classes. What would you say to teachers or families who are concerned about going back without a vaccine?
Well, the most important thing to understand is that we can keep the children, we can keep the teachers and the staff safe. And we have a lot of guidance around that and plans for how to do that. Even when there is still community transmission of the disease, we can institute distancing within the schools, mask wearing, washing hands and other things, cleaning of the buildings and so on. So the most important thing is for parents and teachers to work with the local school departments to really make sure that those things are in place.
And teachers are prioritized.
Teachers are prioritized, but opening the schools is not dependent upon everyone being vaccinated. We are prioritizing vaccinating the teachers, however, because they're such a critical workforce for us.
Someone's asked us, will students older than 16 with underlying conditions be forced to attend school in person without a vaccine?
We don't have any mandates on this, so that is not the case.
All right, wonderful. That's good to know because people are concerned about that. Have there been major side effects or issues associated with the vaccine so far in great number here in the Commonwealth?
Not in the Commonwealth and not in the country. There's been millions and millions of vaccines administered across the country and only about 45 anaphylactic reactions to the vaccine. This is an exceedingly safe vaccine.
All right, wonderful. Dr. Oliver, thank you again for joining us. I want to thank
me.
all of our experts for joining us. We're running out of time here. They include Dr. Cheryl Ivy Green, Dr. Cecilia Barbosa, Dr. Cameron Webb. Thank you all for being with us as well. Dr. Cynthia Morrow and Dr. Lori Archibald-Pannoni. Dr. Robert Wynn from UVA also. Stay with us. Dr. Danny Avula is going to be sticking around for another half hour to answer your questions. You can join us for that on your local station's website. Thanks to you for being with us for Vaccinate Virginia.
The COVID-19 vaccine is here, and you have questions. We have the leading experts here with answers. Sponsored by the Virginia Department of Health.
Thanks for joining us for the exclusive digital portion of Vaccinate Virginia, your questions answered. Virginia's COVID-19 coordinator, the vaccine coordinator, Dr. Danny Avula, is here for the next half hour to answer more of your questions. And Dr. Avula, again, let's start off with the big one. People are worried about the vaccine. People have been asking us, will it cost me? Will it sterilize me? Will it harm me? Can you address those concerns, please?
Yeah, absolutely. So these vaccines have gone through extensive trials. Let's take the cost issue first. The federal government has footed the cost for all of these vaccines. Now, the people who are administering the vaccine, the doctor's offices, the pharmacies, can charge what's called an administration fee to insurance, but if you do not have insurance, there will be no fee to you at all. So be sure of that you can get the vaccine at no cost to you at all. Now, about the safety issue, we have two vaccines that have authorization right now, Moderna and Pfizer. They went through months and months and months of trials, had tens of thousands of people participate in those trials, 44,000 for Pfizer, 36,000 for Moderna, and were found to be incredibly safe, 95% effective, and really very minimal side effects. Less than 10% of individuals had any kind of malaise, sometimes a fever, and less than 1% had any kind of allergic reaction. And so really remarkably safe and well tested among thousands and thousands of people.
That's important to note. Let's also clear something else up. If you're fortunate enough to have received 2 shots, how does your day-to-day life change vis-a-vis social distancing, vis-a-vis mask wearing?
Well, at this point, what we know is that the vaccine is very effective against you getting the disease and having severe consequences from the disease. What we're not sure about yet is if you can still be a carrier and transmit the disease. We're going to need a few more months to collect that data. And so in the meantime, we're asking that people continue to wear masks, continue to socially distance until we can be sure that you can't transmit the disease once you've been vaccinated.
Dr. Avula, what about, let's talk about the CVS rollout. So this week, CVS will begin to administer shots here in the Commonwealth. If you've registered with the state, does that cover you for a CVS registration? Does your CVS registration cover you for your state registration? How does that work?
It doesn't. We tried really hard to figure out a solution with CVS to ensure that people who were on our state registry could get prioritized for CVS's registration. For various technological reasons, they weren't we weren't able to make that happen, which is really unfortunate. But what CVS did agree to is that they would restrict their access to folks who are 65 and over, which does meet a huge need for Virginia. And they also took our guidance on some of the store placements to make sure that some of those stores were really in some of the most vulnerable communities across the state. So people who want to register for an appointment at CVS will have to go to the CVS website to do that. And the health department will continue to work off their pre-registry list for health department run events.
And again, you mentioned that once you are registered for a vaccine in Virginia, once you register, you will be notified by your state health officials or by your local health officials about what the process is from there. You don't have to keep calling back in. They'll reach out to you.
That's right. And know that has not been the case up to this point, but starting next week when we move to a centralized pre-registration system, you will get weekly updates saying, hey, you're still in the line.
Okay, wonderful. That's good to know because some folks have had questions once they registered, hey, am I on the list or what is my status? Let's talk more about this third vaccine that has been in development from Johnson & Johnson. It's up for FDA emergency approval at the end of this month. We could see doses coming in early March. How will that change? I don't want to say the game. How will that change our conditions here in Virginia? How will that affect this process?
Yeah, well, it will be thousands of more doses for Virginia, and every dose is a life saved. And so we really are excited about the prospect. February 26th is when that decision gets made, and we hope that starting around the first week of March, we'll see more doses. Now, one of the other things about the Johnson & Johnson vaccine is that it's a one-dose vaccine, and it doesn't have such stringent requirements in terms of cold storage. And so there'll be more more flexibility in terms of the places we can use it, the ways that we can get it out. And I know that there are some concerns because its efficacy is not quite what Moderna and Pfizer's are. It's about 67% is what we're expecting.
How does that compare to the efficacy of the flu vaccine?
Great question. So it's better than what we see.
Better than what you get for the flu vaccine.
Yeah.
So if you get a flu vaccine, it's important to get your COVID vaccine as well. The efficacy rate is even better from Johnson & Johnson.
And one more point I'll make is that the Johnson & Johnson vaccine, while 66% effective, is close to 100% effective for hospitalization and against death. And so the severe consequences of COVID, the vaccine is very effective.
So there's no reason not to get a vaccine, whether you get the Pfizer that's currently available, the Moderna that's currently available, each of those in 2 doses, or the Johnson & Johnson, which hopefully will come out with just a single dose. What other vaccine manufacturers have products in the pipeline that we might look forward to as we get on into the later spring and the summer months?
Well, the 2 that are probably next in line, AstraZeneca is actually used in many different parts of the world right now. And so they're finishing up their clinical trials here in the United States. Likely the early part of April when we can expect to see that. And then Novavax is going through trials, and they're also being used in different parts of the world. So I expect, by April we'll have significant new supply with these different companies.
And if you are concerned about whether or not you should get a vaccine, there's a really good reason too. We're not just taking the test results and the clinical trials from other countries that other countries accept. We're putting these products under our own scrutiny, which is pretty good here in the United States. What should folks with allergies know about the vaccine? Many people are concerned that their susceptibility to one sort of thing may compromise them when they get the vaccine.
Yeah, so right now there are no clear contraindications to any of the ingredients that are in the vaccine. We expect some degree of response, some degree of symptoms. So about 10% of people who get immunized, what you're doing is you're presenting a new protein to your immune system, and it's revving up your body. And so things like a fever or some body aches or some malaise are really expected in approximately 10% of people who get vaccinated. Now, under 1% will have some kind of allergic reaction, sometimes some itching, sometimes some hives, but really, when tested across thousands and thousands of people, no severe allergic reactions. And so we're monitoring for that. In the very rare cases where there's an anaphylactic reaction, those get reported to the CDC. As that data gets collected, we'll provide more guidance about who may need to avoid the vaccine, but nobody at this point.
Would that kind of reaction, the anaphylactic reaction, present quickly after you've received the vaccination? So it wouldn't be like you'd get to go home and then 3 days you find yourself in dire straits. It would present itself rather quickly.
That's exactly right. And that's part of why our protocols, once we vaccinate, are to observe individuals for 15 minutes after the administration so that we can make sure that that isn't happening. That
they're okay. All right, let's turn now to marginalized communities. There's been a lot of resistance, anecdotally and factually, that minority communities, black and brown communities in the Commonwealth have been reluctant to get the vaccine. We've explained that our testing is thorough. We've explained that our procedures are strong. What can we continue to do structurally here in the Commonwealth to bridge this gap that we have in trust in our medical community?
Well, I think first and foremost, we have to acknowledge the reasons that there is hesitancy. When you look at our country's history, we know that minority populations have not been treated well by public health and by governmental institutions. And that history has led to a lot of the hesitation that we're seeing now. So we've got to acknowledge it. We're creating forums to have that conversation so that people can recognize why has some of this hesitation been handed down from generation to generation, and then we need to make sure that people have good, credible information. So ensuring that people understand the breadth of the studies that have been done. The fact that with the Pfizer and Moderna trials, you had just not quite 10% of African Americans who actually participated in those trials. So we have good data around minority groups, and then really steering people away from social media and to the CDC and World Health Organization and the Virginia Department of Health for really credible, reliable information based in science.
It may be a little bit too early to talk about this, but we warned folks as we moved through Thanksgiving and through Christmas that family gatherings might be places where the virus could spread quickly and relentlessly as it does. Are we seeing now the back end of that, where we had a surge across the holiday season? and now we're kind of fading out with our case numbers and hospitalizations here in Virginia? And if so, is that a trend that we expect to reverse as we get into warmer weather, when perhaps people may go out more, be more casual, find themselves in restaurants without a mask or in social situations?
Yeah, well, without a doubt, the first week of January absolutely saw massive spikes in disease across the state. And now we're on the downside of that. We are seeing rates decrease in many parts of the state. That's really encouraging. I had some concerns that the Super Bowl would bring people back together. I'm hoping that that was not the case in most places. So we'll see what the data does. My hope is that we'll continue to see this downward trend. I do have some concerns with these variants on the rise. We've identified both the UK and the South African variant here in Virginia. We have, as we've talked to colleagues around the world, I was on the phone last week with my counterparts in Israel. They have seen 70 to 80% of their cases are the UK variant, and that happened over the course of 2 months. Our own modelers at the CDC expect that the UK variant will be the dominant strain by the end of March, and so we really have to be committed to the things that we know work, to wash our hands, to wear our masks, to socially distance, and then as vaccine becomes available, let's get vaccinated.
We've talked quite a bit about elderly populations being most at risk, and how Virginians over the age of 65 have been put into priority categories because they generally have the greatest risk for severe reaction to COVID-19 and hospitalization and death. What message do you have for young folks who feel, because of their age and youth and vitality, I remember all that, invulnerable? You don't feel like anything's going to hurt you. You're not going to die. You're not going to get sick. I'm going to go ahead with my life. Reiterate to folks at home why it's important, if you are younger, in college, early 20s, early 30s maybe, why this has to concern you too.
Yeah, well, the first thing I would say is that you're probably right. Young people who get COVID have very mild disease. But the point of getting the vaccine is not only to protect yourself from the rare instance of more severe disease in a young individual, but it's really against you unknowingly transmitting it to somebody who will have a more severe consequence. And so when we strive to reach herd immunity, to get 75 to 80% of our population vaccinated, we're doing that to minimize the transmission and to protect the most vulnerable. And so I'd encourage everybody to get vaccinated, even if you don't think you're going to get severely ill.
Let's talk again about those priority groups. We have 1A and 1B. Explain for the folks here who are watching on the web who are in those groups and why, and who will come next, presumably a 1C group.
Yeah, that's right. So 1A was really the folks that we knew were at highest risk either to contract COVID or to have very severe consequences of COVID. Without a doubt, from the beginning of this pandemic, we have seen terrible outbreaks in nursing homes, assisted living facilities, other congregate care settings. And so those long-term care facility residents and staff were included in 1A. In addition to that, frontline healthcare workers, doctors, nurses, other types of providers, but also dietary workers and janitorial staff in hospitals who are coming into contact with patients day in, day out. So that was Group 1A. Most parts of the state have moved through that. There are still some segments of 1A, perhaps an independent living facility or some like a home health nurse. So we're still prioritizing 1A as they come up. Now, 1B are those tiers of essential workers. And so if you go to that vaccinate.virginia.gov website, you will find the whole list there. Policemen, firemen, correctional officers, homeless shelter workers, teachers, childcare workers, folks who work in grocery stores or in manufacturing industries. There's a whole list of those core functions that our society really needs. And what's happening is right now, about 50% of the vaccine that every community gets is systematically working through those 1B tiers. The other 50% is being prioritized for individuals who are 65 and older. And so in addition to essential workers, 1B also includes individuals who are 65 and over and folks with underlying conditions. 1C, where probably about 3 months from now we'll be starting to transition to, includes other segments of the essential worker population. So folks who work in our energy infrastructure or in logistics or in finance. So there's a whole list of 1C. Again, vaccinate.virginia.gov will take you to the full lists of each of those categories.
Okay. Excuse me one second. Let's talk again about registration. So folks at home are worrying about how to get the vaccine. I've just flown in from Mars. I heard there's a pandemic, Dr. Avula. What do I do?
So as of this week, I would encourage everybody to go to your local health department website. You can go to vdh.virginia.gov. You'll see a map of the local health districts, and you'll be able to click on the site that takes you to your local health district website. As of next week, when we actually launch our centralized call center and our centralized registration process, you'll be able to call a number and have somebody walk you through or direct you to a place to get pre-registered. But more to come on that.
Okay. How has the pandemic changed our infrastructure here in the Commonwealth as far as dealing with a pandemic like this? Are we establishing connections and relationships and protocols that will endure for perhaps the next time?
Yeah.
And if so, what are they?
Yeah, so we often talk about the fact that this last year has just been the most complicated and biggest team project we've ever been involved in. And the response has just required remarkable cooperation and collaboration between health departments and health systems, between all of the health infrastructure and local governments. And I would say that the communities that really got out early with effective vaccination were the communities where the local governments, the health departments, the health providers were all really coming to the table and really connecting the dots well. And so I think there are practices there that we've learned. There are clearly spaces, places like convention centers and drive-through events that we now have really well thought out plans for. And a lot of that drew from our past experience, right? This isn't the first pandemic we faced. When I started in public health in 2009, we were looking at H1N1 as an emergent threat. And so every year health departments have planned around mass vaccination, and this really kind of took that to another level. People are turning to doctors and healthcare professionals for good advice in the pandemic about registration, about getting shots, about side effects, and whether or not your allergies will contraindicate whether or not you should get the vaccine. They do not. Let's talk for a minute about the healthcare workers, the folks who, I don't know, I realize that it's just been about a year since most people kind of had the pandemic, COVID-19, on their radar. What's been the effect on our healthcare workers and on the folks who are on the front lines? It's been a difficult year for everyone, but I'm not working in a hospital every day. I'm not dealing with people on ventilators. What's the toll it's taking? How are they doing? How can we support them? Yeah, well, without a doubt, it has been exhausting for so many of our colleagues who have been on the front lines. I mean, the day in, day out toll of caring for sick and dying patients, but also the anxiety of your own potential exposure and potentially bringing that back to your family and friends. And I would add one other category of early on, when we saw these just horrific outbreaks in nursing homes and assisted living facilities, I think there was a whole segment of our healthcare worker staff that was really forgotten in that. And so I think just acknowledging that, recognizing how the healthcare and public health infrastructure have just been under tremendous duress over the last 10, 11 months, and knowing that they are still pouring it all out right now so that lives can be saved. To acknowledge that, to give them a virtual hug, and to hope that when this is all over, that we all get a long vacation out of this.
It's interesting you mentioned that, because at what point will we know that this is over? What will the signs be? What will the indications be? What factors will we have to let folks know that, at least for the next time being, we can put our guards down a little bit?
Yeah, well, I think the data will have to drive that, right?
What data would specifically what
So
we need?
will continually look at infection rates in communities, in percent positivity in communities, and the number of actual clusters and outbreaks we're seeing in communities. And that will evolve some, especially with the onset of these new variants. And so, our epidemiology teams will continue to surveil that across the state. But the more data we have around how effective the vaccines are, there's the prospect that some vaccines might actually have to develop boosters in terms of these new variants that are coming on. So I don't think we're going to be out of the woods anytime soon. I do think this next 6 months we'll learn a lot about how much these variants take hold, how effective our vaccines are, and then ultimately how much transmission is happening in communities.
All right. So no answers anytime soon, but that's okay, because if you know what you're up against, sometimes that can give you strength in the fight. Let's get back to some today news. The CDC released a study that said 2 masks are more effective at combating the spread of the transmission of the COVID-19 virus than 1. Why is that? How should folks wear their masks now that we know this?
Yeah, so we've been hearing some, you've seen that trend probably over the last few weeks of people starting to double mask, and I think what I've been saying is that it makes common sense, right? The more barriers you have, the less likely it is that you're going to spread droplets and that you're going to breathe in droplets. But now we have the data to actually substantiate that, which is why there was a formal recommendation from the CDC today. So the key there is a good fit around the mask. The way that the CDC outlined their guidelines, a surgical mask underneath and then a cloth mask over. But really it is about making sure you have as good a fit as possible. Masks that have a metal wire that you can place over your nose are better than others. And then the double layer absolutely helps. What's not good is to have a mask that has one of those filters in it that actually allows you to breathe respirate droplets out.
It flaps. It flaps
Yeah,
when you breathe
exactly.
like that. Yeah,
so you're sort of, you miss the point because you're still getting those respiratory droplets out there.
Explain to the folks at home how missing the point also includes wearing your mask below your nose.
Absolutely, because we don't just breathe out of our mouths, we also breathe outside of our nose, right? So we need to make sure that that mask is covering our nose, that it's fit well over our nose. Again, if you have a mask with a metal wire, that's better. But both to protect yourself and to protect others, it needs to fit snugly over your nose and mouth.
Is there any way for Virginians who are looking for a vaccine at this point in the process to request that they get the Moderna vaccine with 2 doses, to request that they get the Pfizer vaccine with 2 doses, or perhaps they prefer the Johnson & Johnson, if it becomes available, when it becomes available, with a single dose? Or is it just a matter of where you are, here's what you get, keep going?
Right now, vaccine is in such short supply that it really is, there's not much choice at all. So the vaccine is primarily being distributed based on the place's ability to store that vaccine. The Pfizer requires negative 90-degree storage, but there really is not a way to choose that. I suspect, down the road a few months where the vaccine is much more plentiful, you can start picking what sites do you want to go to, but that isn't the case right now.
Folks across the Commonwealth, especially in rural areas, have been worried about equity in this process. And because they're not in more populated urban areas where maybe you could have a vaccination event, as we've had several at Richmond Raceway, for example, there aren't those sort of places set up in Southwest Virginia. How can we explain to those folks how the process works for them?
Well, I would first say look at the data around it, just how many folks have been vaccinated in those communities. There are parts of Southwest Virginia, Buchanan County, Wise County is a couple of examples where you have tremendous vaccination rates. And I know it may not feel like that when you're on the ground, but the fact of the matter is the health departments and other partners in those parts of the state have gotten vaccine out at extremely high rates. Their vaccination rates per capita are actually better than many, many other parts of the state. And so we're working hard to make sure that everybody gets vaccine, but everybody right now feels like they don't have enough, they don't have what they need. And the fact of the matter is that they don't.
At the opposite end of the spectrum, you have folks who say they will never take it, don't want it, don't want a mandate, this is government control, that sort of thing. Is there a mandate for anyone to take the vaccine if they don't want to here in the Commonwealth?
Definitely no mandates. These vaccines are under what's called an emergency use authorization from the FDA. While they are under an EUA, there's no way for a governmental entity to mandate or require that you take a vaccine.
Okay. Simple answer there. But we do recommend it.
Absolutely. Absolutely.
And it could help your family. Let's talk a little bit about schools. Governor Northam in this last week has indicated that he would like for Virginia schools to return to live classes in some form or another as of March 15th, just a few weeks away from now. And that is whether or not teachers and students have been fully vaccinated and protected. Why? Is that, I can't ask you why that's his position, he takes his own position. I will ask you, what's the data that supports that being a good move, and how should folks be comforted by the information you're giving them? Yeah,
well, this has obviously been a robust conversation for much of the last year. It is in my household as well. We've got 5 children, and my wife is a school teacher. But the reality is that we, again, have to look at the data, right? We have looked at data both in Virginia for schools that have been in person, around the country, and around the world. And what we see over and over and over again is that schools that are effectively doing community mitigation, they are requiring masks, they're ensuring distancing, they're cleaning well, they're screening out for symptoms, are remarkably safe places for both kids and teachers. Now, you are hearing stories, people are getting COVID, right? You'll see teachers or students that turn positive, but they're not getting it in schools. They're getting it in social gatherings and in other facets of their life. And so I think we really need to be reassured by what we're seeing is that you're not having significant outbreaks or significant transmission in schools that are doing this well.
That is one of the odd things about this, because you'd think that when you get kids together in a place like that, practically, or it would seem that that's the case, but it is not. Let's take that a step further now. So schools are not really the sort of vector for transmission that we expected. There are interruptions when there's a positive case and then all the students who've been in contact have to be quarantined or should be isolated for a time. Should that concern parents? Also, it seems a little bit disruptive, but that's just sort of how we have to do things these days.
It is, and I think some of the school systems that have been able to kind of hybridize and have concurrent virtual with in-person have been able to mitigate against that well. But for the schools that are able to effectively maintain 6-foot distancing, you really minimize the impact of exposure and of potential quarantining. And so in many parts of the state, we've seen schools that have really held to that 6-foot distance, and the potential exposure hasn't affected as many kids.
How is a vaccine under development that would be authorized or that might be authorized for the very youngest of us? Right now, vaccines are not authorized for anybody under 16, I believe.
That's right.
Will that change? And if so, will our vaccination program just be broadened?
Yeah, so we're a few months out from that. The Pfizer vaccine is currently the only vaccine that is eligible for people down to age 16. Back in early December, they were authorized to add kids down to 12 to their trials. Okay. So I think we're still probably 4 to 5 months out from having good data around children and a formal recommendation, but even then, it'll be only kids down to 12. So I think we're months and months away from having a vaccine that's that younger kids are eligible for.
Here's a question that it's off the top of my head. Do you think that we'll get COVID vaccines the same way that we get regular flu vaccines? Is this because of the variants that are coming? Will this be a cycle for us, do you believe? Is there a possibility of that? You get a flu shot, you get a COVID shot.
I think it's pretty likely for these next few years that we're going to require annual vaccines and boosters that are tweaked based on variants. You know, the coronavirus has been around for decades. It's always been incredibly mild disease. And so for the first time, we're seeing these much more severe consequences of COVID mutations. And so not for the first time. We've actually had other very severe mutations in SARS and MERS-CoV as examples. But I think if we continue to see circulation, if our surveillance shows that these are continuing to transmit around the world, I can see this being an annual event.
This pandemic may be an opportunity for people to regain some trust in science, because so much of this work is based in science. Dr. Robert Wynn from UVA told us earlier today that these vaccines are the Beatles and Beyonce, not overnight successes, but things that have been developed over time in the shadows, places that maybe not be so public. But this is really the tip of a fantastic spear that has a long history. Explain a little bit about that, how vaccines are developed. Maybe that will let folks at home feel a little bit more at ease. Yeah. If they're reluctant to get a vaccine.
Sure. Well, we've had decades of experience trying to develop new vaccines, and we've done that in a lot of different ways. One of the remarkable advancements has been the way that these particular Moderna and Pfizer vaccines have used new methods of actually developing an immune response. The basic idea is that you are somehow presenting your body, your immune system, somehow presenting your immune system with something that looks like the virus. And in turn, your immune system develops antibodies. It develops defenses against that viral particle so that the next time your body sees it, you're ready. You're ready to fight it. You're ready to defend against it, and you don't have the same risk of having severe consequences. Now, there's a lot more detail we could go into about the different platforms that are used, but the basic idea is that your immune system is being readied for a future exposure.
And this has been going on for hundreds and hundreds of years. Was the smallpox vaccine one of the first that was developed here
Yeah,
in the U.S.?
It absolutely was, and now we don't see smallpox anymore. And so I think there's a great example of where people, particularly folks who are more hesitant around vaccination, forget a time where we had lots of circulating infectious diseases, yet vaccination has changed that trajectory. I mean, when you look at the causes of death from the early 1900s, the top 5 are all infectious diseases, and now that's just no longer the case. Part of that is public health interventions around hygiene, but a huge part of that is vaccination.
All right, just got a question in my IFB from somebody who's watching along with us here on the web. Can couples make appointments together for their vaccines? If mom and dad need to go together, can they do that?
So if they are both eligible for various reasons, for example, if they're both over 65, or if one partner is over 65 and the other is an essential worker, then that might be a reasonable thing, and health departments and other providers will work with you to schedule that together. If not, then the partner is going to have to wait until they're eligible.
Okay, and one final question, and I think that, again, this came up relatively recently. Don't know why no one's mentioned it before. Don't feel on the spot to answer this. Why do we have to have a vaccine that's administered by injection? Some people don't like shots. They're afraid to get a shot. Why can't our vaccine be taken orally, like your ibuprofen or your acetaminophen?
Well, there have been examples of oral vaccines that have been effective in the past, but those typically are live virus vaccines where you're actually ingesting or putting a live virus into your body to generate a response. The injectable vaccine is the most effective way to get this particular platform. What's happening is you're injecting a small amount of genetic material into your body. Your body reads that genetic material, creates the protein that you see, the spiky protein that's on the surface of every coronavirus, and then your immune system responds. That wouldn't be possible through an oral vaccine, and I'm pretty sure that nobody's willing to take a live virus COVID vaccine.
Certainly not. All right, we're going to wrap up our online discussion now for Vaccinate Virginia. Final comments, Dr. Avula, either on your experience over the last year or advice that you'd like to give our viewers and listeners.
Yeah, this has been extraordinarily difficult for all of us. I mean, this has been, for many of us, the hardest year of our lives. And we have just heard the same messages over and over: wash your hands, wear a mask, socially distance. And so my hope and my encouragement would be that we can hold on to those things for just a few more months. There's hope on the horizon. Finally, we have a vaccine that's incredibly safe and incredibly effective, and everybody who wants to get vaccinated will get the chance to be vaccinated. But let's do this. Let's do this together, and let's be patient, but let's make sure we get vaccinated and can move on from this together.
All righty, Dr. Danny Avula, thank you very much for your expertise and your time, and I'll say personally your dedication over the last year in trying to bring Virginia safely through what is easily the most terrible public health crisis that most of us have experienced in our lifetimes. Thanks as well to the Virginia Department of Health, and for all of our experts who've been part of our discussion this evening. Thank you at home for listening with open ears and an open heart. For all of us here at Vaccinate Virginia, I'm Juan Condi. We'll join you again in a couple of weeks. Until then, wear a mask, practice social distancing, and register for your vaccine.